Hi, my name is Kathy Adamczyk. I work at the University of Connecticut Center of Excellence on Developmental Disabilities, the A.J. Papanico Center. I am the Parent Leadership and Advocacy Trainer and Coordinator at the center. I'd like to talk to you today a little bit about emergency preparedness and how it relates specifically to those on the autism spectrum. Folks with autism face issues and situations that put them at additional risk just by the very nature of their disability. One of the areas that has an increased risk factor is language. About 50% of people on the autism spectrum are nonverbal, and those that are verbal may have speech that might be considered peculiar to other people. The pitch and the rhythm might not be what one is used to hearing. As a matter of fact, sometimes it sounds kind of like a robot type voice. The volume may be at a level that other folks aren't used to. And as a result of this, other people might find the person to be rude, which could really interfere with the kind of assistance that people are trying to give them. Another additional risk that they face is has to do with social relatedness. The way one with autism relates socially, it depends on, one person to the other. They may lack any kind of social skills that we're used to. They may not be able to read body language, gestures. They also might not relate to people the way you would expect them to. Their eye contact might be very poor, with their avoiding eye contact and looking around and seemingly not paying attention to the person that is trying to help them. This could lead that person who doesn't know that they have a disability to think that they're just being evasive, not listening to what they're saying, and sometimes they're thought of as being a wise guy as a result of the difficulties that they face. Emotionally, anxiety is a very common factor with people that have autism, and it can be extreme. And they may not be able to even perceive that there's any kind of a dangerous situation present, which can lead to some problems. Sensory speaking, sensory overload impairs their function, and sometimes it gets to the point where they can't even use language. They also may have an unusual gait or be physically awkward. So if a first responder comes to assist a person on the spectrum, if they've been taught about how to handle the situation and recognize that this might be a person who has autism, they will be better able to assist that person. How can first responders be prepared to assist these folks with autism? Well, the families can provide them with relevant details and information, such as effective de-escalation techniques, a means of communication if they communicate in a different way than verbally. They can provide a map of the house if the child decides to, if it's a child decides to hide or something. In addition, it's good to create a flag in a 911 database, call them up and tell them about the child or adult that has autism. Maybe an identification bracelet to alert folks that they have autism. Provide more detailed information at the local like fire department or police department about your individual so that they can learn more about them. A recent photo of the individual in case you know, you're separated from them during the emergency. Parents should talk to neighbors to, you know, let them know about the person so that if they see them wandering around that they can help out. And it might be a good idea to invite first responders to like parent support groups so that they can learn more from those that care for children with autism. And there is also something called a file of life. This is what it is, and it's a little packet. You keep it in your home, usually on the refrigerator. It's got a magnetic backing to it. And if you pull it out, it opens up, and on each side of it, it has pertinent information for first responders to be able to know about the person with the disability. First responders look for the file of life. They know enough to look for it in your home. And there is a sticker that you can put on your window that alerts them to the fact that a file of life is in the home. To be able to effectively assist a person with autism, first responders should use short, clear sentences. They should be prepared to use alternative communication. They should speak calmly. They should use visuals whenever possible. They should provide a lot of wait time for processing, up to 45 seconds. In addition, the person with the disability should be taught to recognize sources of help, like a police officer, a neighbor that they know, anybody that wears a uniform, like a fire department person. And if that person is able to understand what their disability is, they should be, you know, taught about it so that they can explain it to others. They should be taught how to explain how best to help them. So people with autism present unique safety risks due to their disability, and in order to reduce risk depends on the preparation of the person with autism, the family, and the first responders and community members.